I personally think the most useful phrase in quality and patient safety is this: every system is perfectly designed to get the results that it gets. Paul Buttleton, one of the founding members of the Institute for Healthcare Improvement, created that saying many years ago. Buttleton was summarizing the observations of W. Edwards Deming. Deming was an engineer and native of my home state, Wyoming. He was also a giant of quality improvement. He was responsible for much of Japan's economic success after the Second World War. That success depended on applying the principles we will cover in this course. I'll say it again. Every system is perfectly designed to get the results that it gets. Let's apply this logic to a car. You know that if your car jostles you around while driving down a bumpy road, it's because it was built that way. Maybe the parts that would give the car a smooth ride are expensive, and the manufacturer was more interested in economy than comfort. But that bumpy ride could also be a feature. Maybe your ride is bumpy because people who usually buy that car enjoy a sport-tuned suspension that lets you feel the road. Either way, you don't expect to hop in your car and have it spontaneously give you a smooth ride after years of not doing so. That would be silly. This is something you may already know, but sometimes we fail to apply it to complicated systems like our own hospitals and clinics. I would challenge you to ask yourself if you apply the same test to your workplace. Are you engaging in the same practices over and over again, complaining that work is a bumpy ride? If so, how much time have you spent thinking about your workplace as a system, as if it were a car? Are the bumps at work a feature or a bug? Or have you and your team just never changed the shocks and struts? Again, uncritically repeating practices that only somewhat work is a bad habit. All of us can fall into that habit, but there are strategies to fix the pattern. That is the purpose of this course, rethinking healthcare settings with patient safety in mind. This course will cover essential patient safety concepts. The course will also share stories that illustrate these concepts in action. My hope is that the knowledge and perspectives you gain in this course enable you to improve patient safety in your healthcare context.